We've heard horror stories in the past. From your latest research, how serious is the use and abuse of performance-enhancing drugs in South African schools right now?
Yeah, we've had some research and studies before, but what we're finding is not necessarily the information we were expecting. We've just started the testing program in about 3 weeks, and already we're seeing some alarming trends. We're seeing a lot of what we call stacking and use of cocktails of steroids amongst the high school students, that a few that have been tested. And what that means is that the kids in high schools have a kind of informed view of what steroids to take, because they're taking a cocktail and they know what they want, and the steroids must be widely available for them, or there must be the assistance or complicity of parents or coaches to acquire these steroids for these kids. So it is a big matter of concern about us. What we will monitor as we go on through the testing program, as it unravels, is to see if the steroid use is focused mainly on athletes, or is it non-athletes, and how that plays out. We have a feeling some of our indications have shown that most of the steroid users in school are actually non-athletes, so we will be monitoring that and then see how we respond in terms of our testing program.
So it's not only performance enhancing, it's also for vanity scenarios, one would think.
Correct. It's not well. That's what we're thinking. It's showing that a lot of the steroids are more for vanity, and because it's vanity, there's even more just widespread use. Yeah. And like I said, we suspect it's the complicity of coaches or adults or parents. Yeah. So our education not only has to be focused on the school age going students or athletes, but also on the parents and coaches who may be under the impression that taking these steroids are innocuous, or it's something like taking sports supplements. So again, it's a public health issue, because some of these steroids are injectable, so they are using needles. Some of it are via capsule and tablet form. So we have to address it from different perspectives.
You mentioned adults and parents. Is there a scenario, especially amongst the athletes, of parents being complicit because they see a future of professional sport for their children, and because of that they sort of help them down this road?
Yeah, unfortunately you're correct, Eben. We've in the previous cases where athletes were caught or tested positive, there have been the complicity of coaches or parents, where some of these adults are vicariously living through the kids, and they may not have been exposed or had the opportunities that the kids are exposed to now, and again trying to encourage shortcuts or cheating methods to achieve some form of sporting glory.
And the results of long-term steroid use, how do we make these more public? Because from my perspective, I don't see children being exposed to what the downside of taking steroids, especially in schools. Is that going to be a part of the program going forward?
Yes, definitely. Obviously, you cannot do a scientific study for ethical reasons to see what the long-term effect is, but where people have come forward in terms of talked about the long-term steroid use, we have seen organ damage. There have been cases of cancer, and just from a medical perspective, when a growing child distorts or artificially distorts their hormonal balance, again, there are a whole number of health issues that do come up.
I wanted to ask you about the briefing that you had in Parliament this week. Just tell us what came out of that, and is there a way forward from there?
The briefing was very, very positive. It was the joint briefing with the Sports Portfolio Committee and the Basic Education Portfolio Committee, and we also had the Deputy Minister of Education, the Surti, and he really urged us, he recognized the issue and the problem that we're facing in school, and pledged the support of Basic Education to assist us in rolling out this program, and wants us to work closer together so that we efficiently expend our resources in addressing the steroid issue, but also that we cover a wider platform in terms of the countries, in terms of the schools in the country.
Mr. Galant, thank you very much for joining us. We'd like to talk to you sometime again in future to see how the programs proceed, because it's a real concern, I think, for all South Africans.
Thank you, Eben.
That was